Welcome to the Be Well Collective, a refreshingly grounded podcast dedicated to separating health fact from fiction, offering listeners access to credible, science-based conversations on a wide array of health topics. Each episode features discussions led by medical professionals and experts, providing listeners with the evidence-based insights to navigate the often confusing world of health and wellness with confidence and clarity. Now let's nourish our minds and get into it. Welcome to the Be Well Collective. I'm Sara Hillring, your resident sport and clinical dietitian. I'm joined, as always, by my favorite and phenomenal co-host, our in-house clinical mental health counselor, Riley Speth. How's it going, gal pal?
It's good. Good day for me today.
Excellent. Well, we have a good one for you all today. I'm stoked about it. Riley, can you tell us our topic of focus?
So today we're going to be covering return to play, activity or sport after suffering an injury, aka what do I do now after being injured? Speaking from my personal experience, injury is not something that I thought about, or I think most of us think about, but it really did change almost all aspects of my life. Me personally, I wasn't able to drive, walk. I had multiple surgeries, doing PT, a lot of additional costs to my life. But the biggest part that I struggled with was kind of my identity and my autonomy during this time. I had to depend so much on others, and it really changed the way I perceived myself. So today we're going to be diving into the impact of injury on our mental and physical health, exploring how to know when it's time to jump back in, how to stay sane when you're restricted from your favorite hobbies or exercise, and how to communicate with your healthcare providers to ensure you have the most successful re-entry.
Absolutely. Riley, can I ask you to share what you dreamed about last night?
Oh my gosh. Yes.
It's fitting.
Yes. So in about 2019, I had a pretty significant ankle injury. I broke it on both sides and had to go into emergency surgery, and then had plates and screws put in, had another surgery later on to get it removed. But I was telling Sara about it yesterday as we were talking about recording this episode. And last night I dreamt that I re-injured my ankle and woke up very stressed out. Very stressed.
Yes.
Because I was such an active person prior, and then I got injured and started grad school, lost my insurance, COVID hit, and then all of a sudden I wasn't active. I wasn't able to be active. I couldn't even finish physical therapy. It altered so much for me. So having that dream was pretty symbolic and pretty stressful for me.
Absolutely.
Yeah.
Well, thanks for letting me put you on the spot a little bit and share that experience. I feel like it was well-timed, but I'm sorry it was stressful nonetheless. Injury certainly is multifaceted. I think it's always interesting how it re-shows up or lingers in our mind later on. And obviously, it can really rock us to our core, right? It ushers in a lot of challenge and change. I also had an injury, I guess it's been already over a year and a half ago, which is wild, but I can very much relate to what you expressed, Riley. There's a lot that's intertwined within it. Um, it's just so bloody challenging. It's just so challenging. So I'm hopeful that today's episode provides support for anyone that's actively injured or who may acquire injury down the line. So let's begin by discussing some common injuries just to provide a nice baseline, a little context for what we will emphasize throughout the episode. So, soft tissue injuries, these include our lovely strains, so torn muscle or tendon, sprains, a stretched or torn ligament, and contusions. I like that word a lot for bruises. I don't know why, I just do. They're not fun, but caused by impact or overextension. So those are our soft tissue injuries. We'll get into some of those today. Then we have fractures. Those are your pesky broken bones. They're defined as a crack or a break in the bone. This could be a stress fracture, a growth plate fracture, hairline fracture, or compound fracture. The last one is my least favorite of the fractures. If you know what that is, it's definitely not great. Lastly, we have head and spinal cord injuries. These can range from concussions to a more severe skull fracture or spinal trauma. If you've had a concussion, if you've had multiple concussions, woof, these are unfun, they're rough. And then other injuries include dislocations. So that's where it's a joint injury where bones are forced out of their normal position. We have overuse or chronic injuries, and those develop over time due to repetitive motion. So think tendinitis or, again, stress fractures. And then we also have wounds and skin injuries. So those are considered lacerations, cuts, punctures, or burns that break the skin barrier. We are going to skip wounds and skin injuries today, so that's not something we will cover. But if that is of interest, we can always talk about that in future.
Sara, let me jump in really fast and ask a quick question because I think we're going to be throwing this term around a lot today. So I want to
Yep.
make sure we cover it. What do we mean by return to play?
Totally. Let's define it. So, return to play is the process when an athlete moves from injury to recovery to full participation in sport while minimizing the risk of re injury in the effort to support long term health. We might hear additional phrases such as return to participation. So, an individual may be partaking in rehab or sport, but at a lower level than the desired goal, and they're not yet ready medically, physically, or psychologically to engage. The phrase return to sport is where the individual has returned to their activity, but not at their target level or goal level of performance. And then return to performance is where the individual has returned to their sport or activity and is performing at or better than their pre injury level.
Injuries suck. They can knock us out for a short period of time or a very long period of time. It's super easy to want to jump back into things before we're really ready to. Or the opposite, we're waiting too long, a little hesitant before returning when we should be gradually implementing movement back into our routine.
Absolutely. Well, let's unpack this all further with the help of today's guest. Please help us welcome the brilliant, the Iron Woman, I call her. It's going to make her laugh. And coolest of physical therapists. Welcome, Nicole Griffiths.
Well, thank you. I appreciate it, guys. I'm excited to be here.
Absolutely. Thank you.
Nicole, it's great to have you here. Let's give everyone a little bit more background. So, Nicole is a graduate from the University of Utah with a bachelor's in kinesiology and a minor in nutrition. She earned her doctorate in physical therapy from the University of California, San Francisco. Her expertise lies in runner-focused treatments and biomechanics performance enhancement, strongly emphasizing injury prevention. Nicole adopts a patient-centric philosophy, taking a holistic care approach and empowering individuals to understand their diagnoses and treatment. Drawing from her own athletic injury experience, she's dedicated to patient education and active involvement in their recovery. Outside of her professional life, Nicole is an outdoor enthusiast who enjoys camping, backpacking, trail running, and skiing. So cool. She also completed at Ironman Worlds in Spain this past year
Woo.
and
Thank
loves
you.
to bake.
Yeah, she does.
I try when I have time.
What do you like to bake?
I haven't baked in a while, but during the holidays, I will always make at least a few cheesecakes.
Yeah.
Thanksgiving time, pumpkin cheesecake, Christmas time, maybe it's like a cranberry type cheesecake, and then, yeah, whatever else, but trying to a little bit,
Oh my gosh, all of that sounds great right now.
right?
Forget seasonal, that sounds so
Just make
good.
it all the time. Yeah.
Just make
But
it all the
cheesecake
time.
is obviously my favorite, so I
Yeah,
make a lot of that.
it's always on the menu. Oh, I love that. Well, gorgeous bio, Nick. I know your history, however, our listeners don't, neither does Riley. So can you tell us how you became passionate about physical therapy and how you decided to pursue this field?
Yes, of course. So thanks for such the warm introduction to the pod. I appreciate it. My first introduction to physical therapy is probably in more high school time. I was always playing sports growing up in high school. I ran track, cross country, played some competitive soccer. I was struggling with knee pain when I first went to PT, so I ended up having Osgood-Schlatter's, just basically kind of like growing pains in the knee. I'd grown a ton that year, and my muscles were not quite caught up with the length of my bones, particularly my femur. So, this is a common injury among adolescents, but I loved learning about my body during this time and learning how I could best protect myself from injuries, but also knowing what to do when I started to feel aches or pains from my sports. My coach's wife was also a physical therapy assistant, so she was a big mentor for me as well. I would say my main passion for physical therapy came from my love for movement and sports. I love teaching people about their body, their anatomy, and sharing why movement is so good for us. So injury and surgery can be a really scary time for a lot of people. So it's a very rewarding job for me where I get to be walking them through the process, helping them to heal and educate them. So a goal of mine is always have a patient leave my clinic feeling in more control of their body, understanding what the pain is, what soreness is versus tightness, achy, all of that, so they can better understand their rehab journey and then for future pain or injuries that kind of come along the way.
That's so cool. I love what you said about control because I think that, I mean, for many aspects of life, I think control and wanting control is huge, and especially after injury.
Can just feel so out of control of your body. So kind of getting that back can be very rewarding to see too. Yeah.
That's awesome. I've never heard that from a physical therapy standpoint. So awesome. Well, thanks so much for that, Nicole. Something that we like to do on the podcast, just to kind of break the ice and set the tone, is to have each guest bring either their favorite snack to talk about or what's been on your menu for your snacks lately. So, Nicole, what's your snack of choice? What'd you bring today?
So today I got the Triscuits. Honestly, they're pretty good. I haven't had Triscuits in years. And then my boyfriend brought them home from the grocery store recently. I'm like, why did we get these? But also they're great. So I brought those in today. That's what was left in the pantry.
Sarah, what'd you bring?
Okay. I'm back in the habit of making sourdough, which I'm really excited about. I finally got a food scale and a Dutch oven, which is not required. You can still make sourdough without, but I was really winging it before and it wasn't happening for me.
Yeah.
So I'm really excited to have those two pieces of equipment and it's been awesome. So I love a good piece of toast. I love a bread product. Oh, I could go on forever, but I won't because we don't have time. But I do that and then I've been making a raspberry chia seed lemon
Ooh.
jam.
Okay.
You also are a jam maker,
Yeah.
right?
Yeah.
Yeah.
Love jam. I have apricot tree in my backyard, but
Oh,
I haven't had apricots the last couple years. Hopefully this spring, summer.
okay, fingers crossed for this season. Sadly, my raspberries are not from the backyard. They're just frozen, but they were great. So that's what I've been up to of late with a little bit of almond butter. Oh my gosh, the best combination. Riley, what did you bring? What are you into? Tell us about it.
Well, I brought a kiwi. I actually have an abundance of kiwis right now.
Wait, golden or green?
Green.
Okay, great.
Yeah. I bought a large package of them and they went from being hard, I swear, it happened overnight. Hard, kind of too, not quite sweet, not quite ripe. And then now I feel like I've got to frantically eat these
Get through them.
kiwis.
Yeah.
So, kiwis.
How do you eat your kiwi? That's the real question.
That's a good question.
With this kiwi, I cut it in half.
This is very specific,
Yes.
everyone.
There's a right way and a wrong way to eat a kiwi.
Nicole will be the judge.
I've been cutting it in half. And then when it was too tough, the white part in the center was almost too firm as well. And so I cut a little X in the middle and then used a spoon to scoop it out. Am I correct?
Is that
Yeah,
proper?
that's awesome. I just heard recently people just eating kiwis, taking bites out of them and eating the skin, which I don't know, I guess you can do, but I
It
was
is
just curious.
edible.
But yeah.
You can eat the skin if you
Yeah.
want. Well, thank you for sharing. Everyone, now that we're sufficiently, I think, bringing the snack game energy today, let's transition to talking about return to play. Nicole, depending on the type of injury, and we outlined quite a few of them earlier, what criteria should an individual or an athlete pass before being cleared for full training?
Yeah, so this is a great question. I will start with saying that one of the most important things is still clear communication between the athlete, the physical therapist, the physician, the coach, athletic trainer, everyone involved. So the decision should be based on objective criteria, but we also need to make sure we have an interdisciplinary approach and good conversations to make sure we're just all on the same page and best prepare the athlete for a return to play safely. So with that being said, going back to more of objective criteria that the athlete should pass is first making sure we have allowed enough time for the tissue healing. So based on the research healing timelines, this is going to happen a lot earlier in the rehab process, but the general phases include more of the inflammatory phase, 0 to 7 days. First part. Proliferation phase, that can be 1 to 6 weeks, and that's when our fibroblasts creating new collagen and blood vessels. And then the remodeling and maturation phase. So that can be 6 weeks all the way to 12 plus months. That's when more of our collagen is reorganizing, we're increasing in strength, and this is where we get a lot more of our like restoring our function, and progressive loading is very important. So the length of these phases can really differ depending on the type of injury. Muscles can be a bit quicker. We have different types of kind of muscle tears. Like grade 1 is more minor, so that can be like 2 to 4 weeks. Or grade 2, more of a moderate tear, anywhere 8 to 16 weeks. And then grade 3, 9 to 12 months. So you can see it really can depend on the severity. For tendon, it can be a bit longer, so 4 to 6 weeks, more of our mild tendon kind of strains. 4 to 12 months for more severe, or if we need surgery. Ligaments, that grade 1 can be in like 2 to 8 weeks, grade 2, 2 to 6 months, grade 3, 6 to 12 plus months. Our bone can be 6 to 12 weeks. We can also see that can be a lot longer too with more severe type bone injuries, like Sarah was talking about, more of compound fractures. Cartilage can be about 12 weeks to several months, and then nerves, that can be like 1 millimeter to 4 millimeters a day of regeneration that we can get. So it really can depend on a lot of things. But once there's ample time allowed for these physiologic changes and healing, then we get into more of the strength assessments, range of motion, the power, the speed, agility, all of these come into play. So the objective measures we're kind of looking for are similar among the different injuries, but there is a key difference for bone stress injuries. Before we even get to testing for return to sport readiness, we really have to use pain as our guide when progressing. So if there continues to be bone pain while rehabbing and returning to weight bearing or strength training, we really need to scale back. For soft tissue injuries, we can have some pain continue kind of within reason, usually using that numerical rating scale from 0, no pain, 5, moderate, and 10 being more severe. We usually don't want to go above like a 3 to 4 out of 10, especially for those tendon type injuries when we're rehabbing those. So, for example, let's say a post-op ACL kind of soccer player returning to sport. I definitely want to look at the glute strength, hip strength, especially the gluteus medius, gluteus maximus, the quad, the hamstring. We want full symmetrical range of motion within the joint and the surrounding joints of injury. So checking their hips, their ankles, we have full range of motion there. For strength, our goals are usually trying to get between 90 to 95% symmetry in strength to safely return to sport. So ideally we want 100%, but strength can continue to build as we're returning to full play. So for that athlete returning after their ACL reconstruction surgery, we're testing quad strength, hamstring to quad ratio, where you want that to be about 0.6 to 0.8, so 60% strength, the hamstring of compared to the quad. And then we want a functional quad and general lower extremity strength are the must-dos. So ideally, we can use a dynamometer for more standardized and accurate reading of strength, usually in pounds of force. And you can do that seated, knee extension at like a 60-degree angle. If we don't have a dynamometer, which many clinics don't, since they're expensive, we can always have the patient go to a gym, use a resisted knee extension machine, and perform anything from like a 3 to 8 rep max for knee extension. Have them record their weight for each side, and then we compare that way. So often we'll have them record their knee extension strength for their quad. We'll do a knee flexion one for hamstring, and then maybe more of a single leg press for more of a compound movement. So it's important to look at 1 rep max strength, but we also want to look at the endurance of the muscle too. So this is where you can get a little bit creative in the clinic as well. So I'll often have the athlete perform a single leg sit to stand from a standard 18-inch height chair, and they're doing as many as they can before failure or fatigue, or you just have them do it for as many as they can in 30 seconds. So other important return to sport tests depend on the sport they're returning to. But since the ACL reconstructions are just so prevalent, this definitely has the most research surrounding it. So we have great standardized tests, things like the single leg hop test. So that one can include 4 different tasks. They can all be performed for an overall average, or you can kind of pick and choose, because in clinic, oftentimes, you may only have half an hour with them. So you can pick from the list of single hop for distance, maybe the triple hop for distance, triple crossover hops for distance, a 6-meter timed hop. Together with all the results, we kind of create a mean limb symmetry index. So that's in a percentage, 100% being complete symmetry between legs. And these are valid and reliable tests for patients following this ACL reconstruction, but they're also not perfect. So the contralateral knee may also have sustained an injury. We may not be looking for perfect symmetry, but improvements in both lower extremities over time, both before returning to sport. So these can test your dynamic knee stability, the power, the strength, and observe if there's apprehension or lack of confidence in the knee, kind of all in one. So there's tons of tests out there, like the T test for agility and cutting. That's got normative times for males and females. Same for kind of vertical jump, drop jump. There's just so many to really pick from depending on what sport you're returning to. So the important thing is recreating the different aspects of the specific sport. So soccer, that includes the endurance running, the sprinting, cutting, agility, shooting, and jumping. So we may add back endurance running, passing the ball first in practice, and progress into agility drills before ever returning to full play or game. So I know that's a long answer, but so many factors affecting it. You really have to look at the whole picture of it too. So
Absolutely. Can I ask what your favorite hop test is? Which one do you like?
I think I like probably the triple hop test one.
Yeah.
Definitely need some space for that. So I will say more often though, I'll do the single leg hop just for space reason. And oftentimes, you do 3 on one side and 3 on the other, and they're fatigued, and we're like, okay, that's the measurement we're getting today. But yeah, so I like some of those hop testing ones for sure.
I do too. That's
Yeah.
why I asked. I was curious. They're kind of fun.
Well, thanks for covering how complex returning back to sport can be and kind of what your world looks like. But I'm really curious, why does simply not giving an injury time to heal not necessarily guarantee that we're ready to return to play? Why can't we just wait it out?
Yeah, so for a while, research was recommending that athletes following a ACL reconstruction could return to sport in like 6 months. So, with more research coming out though, and showing that most of the re-tears are happening the first 6 to 12 months after surgery, it's now recommended closer to 9 months. So, the research is always changing on it. With that though, it's also important to note that over the first 3 months following an ACL reconstruction, the athlete may feel a lot stronger and stable already, but the strength of the graft is actually at its lowest at around that 3-month mark. So, this is because once the graft is implanted, there's necrosis as it takes time for that revascularization. New blood vessels are reaching the ACL. We have to have the blood supply to increase the strength of the graft and make sure it's stable. So oftentimes at this 3-month mark, they may feel ready to start introducing more of the sport-specific drills and exercises, but we really have to consider that graft strength at this stage and the risk for re-tearing. So time is an important factor in those first stages, especially for that physiological healing to occur, but we can't use that alone. So at 9 months, one athlete may be ready to return to sport while the other needs a lot more time. At this point, the other factors like the strength, range of motion, their endurance, agility are so much more important to look at because they're going to affect their re-injury rates and also make sure we can return back to a high level. The bone and the graft may be safe after 3 months, but we've lost that muscle, flexibility, the endurance during that time of rest and healing, so we have to regain that. One example I'll give is a young patient of mine who is about 12 years old, multi-sport athlete. He had an ACL tear. His doctor cleared him for running based on the time since surgery, which was about 12 weeks out. His parents came to the appointment that day and informed me of the updates from the physician. He was not ready to run, though. So, in order to keep that trust and kind of confidence in the rehab process with the athlete and the parents, I had him go through single leg hopping and running in place. And it was obvious we definitely needed to keep working before having him run because he wasn't able to perform a single leg hop on that limb without major pain or compensation, and he wasn't able to run in place without holding onto something for support. He just hadn't done this yet. So overall, each athlete, patient, they respond differently to surgery and rehab. Plus, there's always other factors, other things happening in our lives or surgical complications, or other repairs that maybe happen during surgery, like a meniscus repair during that ACL reconstruction too. So this will change the course of rehab and returning to sport. So we really have to approach each athlete as an individual using these general timelines, but making sure we use objective measures to also help make our decisions.
I know Riley had a bone injury. I had a soft tissue injury. So I'm curious to compare the two, are there, generally speaking,
Hmm.
differences in recovery timeline between a soft tissue and a bone injury? Obviously, every case is different, right? Surgical intervention will really vary timelines, but I'm really curious if you can give a little more clarity to that.
Definitely. There are differences in the recovery timeline and treatment for the bone and soft tissue injury. So, for both soft tissue and bone injuries, it totally depends on the severity and the location. But in general, soft tissue does heal faster than bone. And a large factor for this is blood supply. So, we have more blood supply to muscle, it's a contractile tissue versus tendon, ligaments, and bones. So, muscles can heal faster. Bone does require that mineralization during healing, which also takes time, so making it a longer process. Let's take long distance runners. So they're more prone to lower extremity stress fractures. A tibial stress fracture that could take 6 to 8 weeks, maybe in an orthopedic boot, plus possibly with crutches. But if it was more of a navicular bone that develops a stress fracture, this can take twice as long to heal because of the poor blood supply to this bone. We can also compare the type of fractures. So, stress fracture versus a compound fracture. Stress fracture is a small hairline fracture caused from overuse and usually repetitive sports like running. It can often be missed on imaging, even MRIs. Compound fracture is a very serious injury where both the bone breaks into pieces and there is soft tissue damage, which can include the skin. So, good time even to bring up Lindsey Vonn, who recently just had a compound tibial fracture in her Olympic downhill ski race. She unfortunately had a pretty bad crash where she got airlifted off the ski slope in Italy. So, this was really heartbreaking to see. And this kind of fracture can require multiple surgeries to stabilize. And there are some big risks for infection, compartment syndrome in the leg, where the blood supply can become cut off due to the damage, the swelling, and surgeries. And oftentimes, surgery like a fasciotomy may be required to reduce the pressure. Otherwise, if not treated, there is that risk of losing the leg as the blood flow is not reaching the tissues for them to stay alive. So, compound fracture and the complications can mean that she may not be recovering or being back to her like activities of daily living for over a year. So, it really can just depend.
Mm-hmm.
There are a lot of factors affecting healing, so it can really vary greatly. But let's talk more about general return to sport progression for more of a recreational skier who sustained a hairline fracture in the tibia that didn't require surgery. So we can say initial healing that could maybe take about 6 to 8 weeks in the boot with crutches. After this, the next step is restoring more of that normal walking gait for general activities of daily living or ADLs and begin more weight bearing and resisted strengthening. So, this could look like general squats, sit to stands, shallow lunges, some step ups, step downs, and then progressively adding weight to this while moderating the pain in the proximal tibia. So, there may not be a lot of walking for exercise at this point, but they could get back into using the bike or the swim as another mode without creating too much stress at the tibia. So, once we've returned to our normal kind of ADL movements, like walking, stairs, getting up from a chair or the ground, we can start more progressive loading and eventually plyometrics. So, once we're in this stage, this is where we can start to get more creative again. If we have a recreational skier wanting to return to black diamonds, we may start with lateral deep lunges with weight, move to more of skater movements or like a lateral hop kind of over a bar or a line to get that lateral hopping, the dynamic knee stability, and absorption too. So, quad strength and endurance will also be important. So, moving from mini wall sits for 30-second holds, then to deep squat holds with weight, and then moving to more explosive jump squats for vertical height. So, in terms of endurance, maybe we're starting with a return to running program about 3 months out, starting with 30 seconds of running on the treadmill, a couple minutes walking for 5 rounds to start. So, during this time, we're assessing the gait mechanics and pain and really making those changes as needed. Eventually, we may be working towards 3 miles of sustained running. Eventually, then they can return to green runs, progress to the blue, and then get back to the black diamonds for the ski season.
Okay, so I may take back what I said about soft tissue versus bone, but maybe it just, depends on the
It
type.
can totally depend.
Compound fractures are gnarly.
Mm-hmm.
So, how do you work with someone shattered a bone into multiple pieces? Obviously, there's surgical intervention there, but does that change the protocol if we have so many like small breaks?
Definitely. It's just gonna take a lot more time, and it's a lot longer sessions we have to spend with them too. If there's multiple joints involved, it's hard to target all of it at once. Sometimes we will break it down a bit, but yeah, it's just a lot more time. And some of them are already, my patient, he was ready to buy his next motorcycle right away, which was crazy, but that's what we were kind of getting him back to do. So,
Yeah.
just taking it one step at a time, and yeah, just being really cautious too and looking out for any still having a risk for compartment syndrome, anything like that. So,
Yeah, I think it's really natural to wanna go back, right, to your activity, your sport, like, even if there's that risk of crashing again, it's something that we love, it's something that really brings us joy or gives us a nice break from just the realities of life sometimes, so I can see even if it was a really complicated injury, that individual was like, "I'm, like, ready to go." Like, "Let's
yeah,
get back on the
yeah,
bike, let's
got a
go."
goal and we work towards it.
Yeah, exactly. I have one more tandem question off of that, which is we didn't cover fascia. Are you able to regenerate fascia?
Somewhat. I will say there's a lot of like scar tissue that will be put down with fascia type injuries, so not as regenerative as our like muscles, which can be great. Oftentimes with muscle tears, we may not even need surgery, or we're able to still strengthen the area where we may be okay. But I know you may be thinking of plantar fascia,
Of course I am. That was my
where
injury.
yes,
Yes.
maybe more unlikely for full like regeneration, but again, it can depend. That's physical therapist's favorite saying, "It depends,"
It depends.
which everyone hated in school hearing that because it's like, well, that's not helpful. But then you really do start to see, yeah, there's a lot of factors that it'll depend on. So,
How do you tell the difference between what good soreness is versus pain that might suggest re-injury or pushing too hard?
this is a really great question because this is one of the main concepts that we really try to educate our patients on early in the rehab process. Because there will be those different sensations throughout the recovery. I think athletes in general usually have a more developed kind of body awareness since they're active and they can tell what the soreness versus the achiness and tightness kind of feels like. So that is helpful. But if they're not familiar with these sensations, it is a very important topic that PTs need to require patient education on. So, bone pain can feel sharp, deep, intense, and it can often persist at night. The muscle pain can be more achy, dull, and feel like a tightness. It can also be a more generalized area where the bone pain can feel more kind of deep at a specific point. Nerve pain, we help patients recognize this by giving descriptive words like numbness, tingling, a zing type feeling that they may feel is sharp through their leg or their limb. When rehabbing after a bone stress injury, especially with the stress reactions or stress fractures, we're really watching for this type of bone pain reappearing. The aches and pains that we feel during the process are important to differentiate. As we are strengthening, it's normal to feel that kind of good soreness, but that should also dissipate within a couple of days versus a more bad pain that could linger longer. And maybe it's a sign we may need to modify our plan or possibly regress in order to prevent injury. But definitely is a big topic we constantly talk about because it's always checking in with each visit. How are we feeling today? What are the sensations we have? Talking through it. But there are often times where we'll say, we don't want to focus too much on it. We got to trust our body too and not get caught up too much on maybe if it is feeling more sore, normal to feel that, especially as we're strengthening more. So, yeah.
I think pain is tricky because it's subjective, and I think sometimes it's hard to know how to rate your pain. Like, I think of individuals that maybe are competitive or have been in the athletic space for a while, and they know how to live with pain, and maybe they have a high pain tolerance when people
Hear it
say
all the
that.
time.
Yeah, I'm sure you hear that all the
Yeah.
time, "I have a high pain tolerance," and there's lots of ways to define that. But I think that makes it challenging when we're trying to come back from injury and when we're used to living with like, "Oh, I can do that. That pain's not that bad. It doesn't like it feels better than it did yesterday." Whether that's true in terms of the healing process actually being progressed or not. So, what are common mistakes that you see then when people are coming back from injury? That pain level is maybe tricky to understand and they jump in too fast too soon because of what I described.
I think One of the most common mistakes that athletes or patients can make when trying to come back early from an injury or too soon is comparing themselves to others and increasing the overall load too quickly. So, we often want to compare our progress and timeline to others who may have gone through a similar injury or surgery, or maybe we're comparing our progress to what we read online. Knowing the general timeline is good, but there are so many other factors that can change it. So, one being the type of surgery, possibly the type of graft you got for ACL reconstruction, maybe where your muscle tear is. Was there a medial or a lateral meniscus tear? The type of tear, was it a bucket handle tear? But also how our body responds to surgery. So, for some people, they may have a bigger inflammatory response, and it can take a lot longer for that swelling to reduce. So, it delays their progress a little bit. I think we also forget that our bodies respond to all kinds of load and stress. And that stress can take many forms. So, physical stress, emotional stress, mental stress, all of that affects the body. So, we have to remember that we need to listen to our body. It will often let us know if we're moving too fast through the rehab. So, a good example I like to give for runners when thinking about return to running is when we're discussing load, we like to follow that general rule of not having a greater than a 10% increase in intensity or load for the week. So, intensity can look like increasing the pace, the mileage, the number of days running, maybe you add in a hilly workout. All of these factors can change the intensity or the load or the stress on the body. So, often I will see a runner maybe start at 10 miles a week. The next week, they may want to jump up to 15 miles. And this may seem like a reasonable jump, but we have to remember that with these lower numbers, that's already 50% increase in the load. So, if they have a goal of running a slightly faster pace for their runs that week, moving from an 8-minute pace to maybe a 7:45-minute pace for their base runs, and then they also want to have a run that includes some hills, plus they're traveling for work that week, you can see how all these factors together can be a huge increase in the load for the athlete, even though separately they can look like small and minimal progressions. It's always important to not overly compare ourselves and our progress to others, but also to remember a gradual increase in load is the most important thing.
I think it is challenging to listen to your body, like, to really, like, tune in and recognize, like, where you're at, and you have so much, like, aspiration to engage in that activity or that hobby. It's really important to do that so you don't prolong an injury, but I just wanna make space for the fact that it's not easy. Like, it's not an easy task to be done. I think it's so hard, and it's, like, a practice that takes a lot of continual growth on.
I'm just thinking about the team approach. Yes, the injury might be an individual person. You were talking about the multi facets of the importance of having a team and having your coaches involved or your PT or your doctor and like having all of that so then it doesn't feel so isolating
Mhm.
because it's just hard. It can really hurt our identity and change a big, significant part of our life.
Yeah. Definitely, especially when we spend so much time in that team environment or doing that activity, definitely becomes a big part of your identity and you can feel very lost when you have to stop. But then also when you have that chance to get back into it, of course you want to go kind of full force, do it every day, but it's kind of trying to hold yourself back a little bit and give yourself time to recover during it so you can safely get back to it. But it's tough. Yeah.
Not to get back to like 100% right away.
Yeah.
Progression is so important.
Mhm.
Are there things that parents, coaches, trainers, really anyone involved should know about supporting an athlete in the rehab process?
Yeah, it's a tough process recovering from injury and sitting on the sideline for their sport, like we talked about. Most of the time, athletes want to return to their sport as quickly as they can and they don't want to miss out. They're competitive. It's important for parents, coaches, and trainers to really support the athlete as they're navigating their rehab process while also giving them space if needed. But I think it is great for the athlete to still be part of the team in the sport during this time. So, whether that means coming to the practices or games, performing their rehab while they're there, and just still being a part of the team atmosphere. It's hard for these athletes who may spend 5 to 6 days a week training with their coaches and their team, and then all of a sudden they're at home alone or in the clinic and they're not with their team or in that environment anymore. So staying involved, maybe helping coach or maybe help with equipment during this time can really help keep the motivation and not lose that part of their identity. Often sport is such a huge part of their identity, so trying your best to be involved in any which way I think is really important. Another big aspect is making sure there isn't too much pressure too early to return to sport. So the athlete may be on a scholarship or a contract and they have pressure from the school, donors, or the team to return early. It's really important to put the athlete's health and well-being first. I will say though, with sports, there always comes a time when we may have a senior in high school, maybe they sustained an ankle sprain during basketball practice. Their final game is that week. I mean, ideally, we want time for healing, including the swelling to reduce and then that gradual progression back into loading and twisting type movements before going to back to play. But it's their senior night. They're not going to maybe play in college. And the player, the parents, and the coaches are all aware and understand the risk of them playing this early. I mean, I wouldn't hold them back. I would let them play, prepare them as best as we can. But that's the thing about sports. We're always kind of walking on that edge of trying to get athletes back as quickly as we can while still having them perform at their best, especially at the professional level. So sometimes it works, sometimes it obviously doesn't. Yeah.
I love that concept of like keeping a tie to your team, like be involved however you can. It might not look like actively participating in that sport physically, but just being involved, cheering on, coaching, like you said, equipment management, like all of that matters. And that still keeps you at the practices, at the games, and feel like you still have that link.
Yeah.
I'm curious when you have an athlete come in and let's say timeline is delayed, right? Like recovery is taking longer than expected. Injury is never linear. It has its own timeline sometimes, oftentimes. And maybe that athlete, that patient has some fear about telling their coach, like, hey, I can't play.
Yeah.
Are there any words of wisdom that
Yeah.
you recommend to that person?
That open and clear communication is the most important thing. So, with that, like we said, rehab and return to sport, the plan is fluid. It often doesn't work on hard timelines. So, there needs to be some of that flexibility involved in case the plan needs to be modified. So, I think it's more helpful to come to the coach or trainer with those objective goals they need to hit before moving to the next step or returning to play. So these could be strength goals, the hop symmetry goals, or running goals, maybe no pain for a 3-mile run at a certain pace and no pain following for the next 2 days. So this allows for better communication rather than just 4 weeks of PT before returning to full practice. And that way we can all still be on the same team, but with the same goal of safe return to sport. So I think it's a lot more helpful having those things where there's a general timeline, but these are more important. We need to be able to hit these so we can return safely.
Mm-hmm.
I like that you use those markers instead of a specific timeline of like, hey, this is going to be a 3-month process. You might say generally it could be this.
Exactly. Yeah.
Is there anything that physical therapists do or that you do specifically to help your clients build their confidence or help them feel like themselves again?
Yeah. So this is one of the most important factors, that confidence to return to sport. It can predict the re-injury rate too. So going back to the research on the ACL reconstruction, the score on the anterior cruciate ligament return to sport after injury outcome measure were actually more predictive of re-injury compared to our functional tests, including our hop testing and strength testing. So this outcome measure can assess the athlete's physiological readiness to return to sport following their ACL reconstruction and rehab. So it has 12 questions. It can be a very helpful tool to use throughout the rehab process to gauge their confidence and trust in their knee following surgery. So using these type of outcome measures throughout the rehab journey to track the progress can be really helpful in having the athlete recognize the progress they've made. So tracking their progress in the objective measures as well, like their pounds of force improvement over the weeks for their quad strength, maybe their single leg hop distance, their sprint times, or their T-test times for that speed and agility. This way, they can see the improvement in the numbers, which will help gain that confidence for them. It's also important to go through each separate aspect of their sports, and that will help reassure them that they are ready to return to sport fully. So this could mean for the soccer player, they've already practiced the passing, the sprinting, cutting, jumping, heading the ball, and shooting, all of those things before getting back into full play. So they're not doing anything for the first time in full play, and they're not feeling unprepared or second guessing themselves.
Okay, Nick, can we play a little injury trivia with you?
Let's do it.
Let's do it. Are you ready?
Yes.
Okay. Which sports consistently rank as those with the highest concussion rates, particularly those that are in high school or collegiate athletes? What would you guess? There are multiple sports, so there are multiple answers here.
Yeah. I mean, going to more of those contact sports, I think. I mean, our good old football, maybe some rugby in there.
Yes.
Yeah, definitely for those concussions. That would be, yeah, first guess, more of those contact sports.
For sure. Yeah, football definitely dominates the high school statistics. And then for soccer, actually, for high school girls, is one of the highest incidence rates. But you're spot on. Like any contact sport, there's
Yeah.
definitely a risk. Hockey is third,
Okay. Yeah.
and lacrosse is fourth. Are any of those surprising, or is none of that surprising to you?
Checks out.
Excellent. You crushed it. Let's go to the second question. So let's talk about sports that have the highest rates of soft tissue injuries, ACL, MCL, all that good stuff, Achilles. Any guesses on the professional level? What would be in like the
Yeah.
top three?
So I kind of think of like boxing, MMA, because obviously a lot of soft tissue injuries in the face. I don't know if we were maybe thinking about that, but then again, I would have to go back to like contact and those kind of like agility type ones. Especially basketball too. They play so many games during the season. It's insane. They're just bound to have an overuse or something to break down somewhere during the season. So I would think that for sure.
I didn't have boxing
Oh.
on my list, although that's not to say it's not right. That sounds proper. You could definitely get facial injuries. Basketball for sure is on there.
Okay. Yeah.
Achilles is definitely one of the main ones. Have you seen someone where like they've torn their Achilles and it gets balled up in the calf?
Yeah.
That's a tough one. So basketball, high ankle sprain, ACL. Football's up there, so American football, rugby. And lastly, soccer. So sprains, strains,
Yep.
contusions. You're a soccer player, so I'm sure you're well versed
Oh,
in
yeah.
those.
Gone through the ankle sprains. Yep.
Okay, last one for you before we wrap it up. What about sports with the highest risk for acute sports related fractures? What would you guess for fracture?
So, again, I'm back to football. I would think a lot of fractures, contact sports. I mean, probably hockey as well. I know they were in a lot of padding though. Yeah, I mean, skiing, definitely a lot of fractures too, especially like our kind of speed skiing. Yeah. I think there's so many though. I'm like, yeah, so many. It could happen in soccer and lacrosse for sure. Yeah.
Yeah, you hit it out of the park. I think you got every
Okay.
single
All
one.
right. Nice.
That's great. Well, awesome job. Yeah, you crushed it. Football consistently ranks with
Yeah.
most injuries and highest rates of injuries. Soccer's up there for lower extremity, and then basketball is also lots of contact sports. We can't exclude hockey. It's definitely in there as well. And then skateboarding, a lot of like wrist
Oh, yes.
and arm fractures. So that was awesome. Thank you so much for sharing your expertise and spending all this time with us today. We really appreciate it. As we close today's conversation, I want to give you a chance to like plug where you work, how patients can find you, anything you'd like to share.
Thank you. So if you're looking for some PT help, so we're in Utah. I'm in Holiday and I work at Mountain Land, so that Holiday location. You can come out and if you need any physical therapy help, I'm there. And then you can always reach out to me through email, nicole.griffiths@mlpt.com. So thank you.
Thanks so much for being here, Nicole.
Thanks for having me. This was so fun.
Another thanks to Nicole for being on the podcast with us. The return to play process is certainly not an easy journey. It often requires modifications of routines, training, quite a bit of work to get back to our pre-injury level of performance, and can really weigh on us mentally and emotionally. Riley, let's move into talking about how to manage injury from a mental health standpoint. Will you provide us insight on how to support ourselves during the injury process amidst the psychological toll and frustration recoveries can bring?
Yeah, when someone gets injured, they're not just dealing with pain or physical limitations. They're often coping with complex loss. Routine, identity, community, all these things are involved. So, feelings such as frustration, anxiety, discouragement, this is an interesting one, but maybe even relief and sadness are all common to feel, as an injury can be a really big disruption to our lives. Some questions that came up for me when thinking about this episode were kind of as follows. So, if you're listening, maybe take a second, pause, ask yourself these questions, even if it was a past injury or an injury that you're currently struggling with. What are or were your expectations for your recovery? We're going to have good days and bad ones, and it's important to acknowledge that recovery is rarely linear. This might mean accepting that progress might move at a slower pace and might not match those expectations. Give yourself permission to move at the pace that your body and nervous system need. How does your identity fit into your injury or recovery? I think that this is a key piece, as our self-views are tied to sport or activity. If our purpose is wrapped up in activities that we're doing, what then after you are injured? Are there ways that you can be intentional and seek out other ways to contribute or engage with your community, whether that's sport related or not? What emotions are present for you? Remember a few minutes ago when I named some of the more common emotions? After an injury, you'll get a lot of people trying to tell you to stay positive. Instead, I would encourage you to check in with the emotions that you're feeling and allow space for them, even if it's really uncomfortable. Skills such as mindfulness, journaling, or even just naming and digging deeper into those emotions you are feeling can help reduce the emotional intensity. And lastly, what does your support look like, and is it enough? Injuries can feel extremely isolating. If these emotions we talked about don't go away or feel too intense, it might be time to reach out for support. This might mean therapy. It could also mean reaching out to friends, family, teammates, etc. The goal is to protect yourself during this challenging time and not to let it lead to feelings such as shame or fear that will stick with you after you have recovered.
Okay, wow. Well, thank you for that, Riley. I think I certainly could have used that mindset as a younger athlete and just making space for important reflection. So I echo taking the time to do that for yourself and check in. I'm curious to talk about in terms of athletes or patients that have fear of re-injury. So the chance of it reoccurring maybe in a different way, but that same site gets injured. We also call that kinesiophobia. How can a sports psychologist or a mental health therapist be supportive here?
Let me first just say, fear is so common to feel. And honestly, I would dare to say healthy to feel when you're injured. It doesn't mean something's wrong with you if you're feeling fear. I guess my approach as a therapist would be to lean into that discomfort and talk about that fear. So let me give an example for this. A college soccer player tore her ACL last year during the season. Rehab has gone well. They're cleared to play. From an outside perspective, everything looks good. But internally, things look a little different. These are some things that this person is noticing. They're avoiding movements without even realizing it. They're playing very cautiously, feeling tightness in their body before drills. There's some spike in anxiety before games, not really trusting their body and getting mad at themselves for not being over it. So all of these things listed above don't mean anything is wrong with this athlete. Their body and nervous system are just trying to adjust. We associate specific movements with threat. Fear tries to protect us, and it takes a bit to try to retrain and build that internal trust that we have. Therapy is here to normalize that fear, not necessarily fight it, which might mean gradually rebuilding that trust. Therapy might change the thought from trying to reject it, so like, I should just be back to normal, right? To understanding the importance, which might mean I can play again, This is really scary, and that's okay, right?
Mhm.
So maybe just an example to think of that, like, it might not be the same coming back from an injury.
Yeah, absolutely. I think we all have probably felt that with one activity or another. I felt that like resonate in my body when you were giving those examples, like tightness before drills, spike in anxiety, not trusting your body. Those are all really clear examples that even if we look put together on the outside, there's some more internal work to be done. I felt that deeply when you were chatting about it.
Yeah, good. And it's important to note that sometimes it's subconscious. Sometimes we don't realize what's going on or what it's tied to.
Yes.
And so, really digging in and doing that deeper work is
Hmm.
important. Sarah, what about the nutritional side of recovery? Does anything change with nutritional needs when it comes to return from injury?
Oh, for sure. Of course. When it comes to recovering from, let's take a soft tissue injury as our first focus. We're going to emphasize higher protein with this individual. So we're really looking to prevent muscle loss and aid tissue repair here. Now, that amount of protein is going to be individualized per patient. Other nutrients of interest here are going to be vitamin C, collagen, omega-3 fatty acids, and zinc to continue, again, that tissue repair and management process of inflammation. Although protein is, of course, of high importance, carbohydrates matter. They're still important. So please don't leave that out of the equation. We're just modulating the protein a little bit more
Hmm.
as a result from a recovery standpoint. So those are pretty key when it comes to soft tissue. Oftentimes, when we have injury, whether it's bone, soft tissue, we might have to get surgery. And so, needs are going to vary throughout the timeline of injury. So, adjusting energy, nutrient, and hydration intake is going to vary from the first 24 hours to the weeks or months after the acute phase. So, that's initial injury, or from injury to surgery to post op. We're going to have quite a few fluctuations in what each of those categories look like for us. So it's really key to have a sports dietitian online to ensure that you have optimal recovery and you're consuming what you need. It's really typical for individuals, patients, athletes to undershoot those needs. I'm performing less, so I don't need very much. That's not accurate, right? So I'm not performing as much. I don't need as much food. I don't need as much intake. But your body's going through repair. It's going through recovery. Maybe we got surgery. That's a big endeavor. That's a huge metabolic load. So needs are really going to vary and needs are going to be likely more than you think. And then hydration is always really important. That's how your nutrients get from point A to point B. So we need to have adequate hydration as well. I will say if I'm coming back to soft tissue, I would highly recommend for most individuals, we start supplementing with collagen. Collagen is really key to, again, that repair and recovery. And so generally, I'll have an individual I'm working with take that collagen roughly about an hour prior to going into rehab exercises, or maybe they're going into physical therapy. And that's going to maximize the collagen synthesis process in the tissues. And that's going to aid with more of that rehab right out of the gate. So usually that dosage is like 15 grams of collagen, and you combine it with 50 milligrams of vitamin C. Vitamin C and collagen have a nice, fun relationship, and they need each other in order to absorb properly in the body. So we talked about soft tissue injuries. Just to make sure we are comprehensive for the listeners, we'll go through the other injuries we discussed today and what types of interventions are appropriate for that. So we'll go through concussions or head injuries. They require a similar approach. Early nutrition intervention is key in recovery. Ideally, as soon as the individual or athlete has been removed from play and they've been screened, such as a game or an event. You may see this in the NFL. They'll take players into the blue tent for evaluation, and then they'll maybe walk them out of the stadium. We want that individual to start consuming a protein-rich snack ASAP to start that recovery process. Probably not too surprising with concussions, we need an increase in omega-3 fatty acids. Those are really key in supporting brain health and being able to aid in that recovery process. They are involved in muscle mass building and strength support. So that's pretty cool that they have kind of a try approach when it comes to recovery. So we usually recommend increasing that in one's dietary intake. And then supplementation might be warranted. Usually we'll supplement if it is a pretty significant head injury. Usually we'll supplement if someone is a vegan or vegetarian. They're less likely to maybe get some of those omega-3 fatty acids because our food sources are limited. As always, I plug speaking with a dietitian. That's super important to ensure you have the proper protocol in place. We really don't want to mess around with head injuries, do we? Absolutely not. And then lastly, we'll wrap it with our bone injuries. With bone, we want to make sure that we're consuming enough calcium. So individuals should aim for about 1,500 milligrams of calcium per day. If their vitamin D levels are not already in an optimal range, then this is an excellent time to order labs to confirm and see if we are deficient, and then supplement appropriately per that deficiency to correct for any deficiencies that did arise. We can always, of course, focus on vitamin D rich foods. We just don't have as many of those. So supplementation is usually warranted. Vitamin K is also key for bone healing, so encouraging patients to consume sources like egg yolks, fatty fish, kefir, sauerkraut, chicken, all of those can be helpful. And that being said, supplementation may also be warranted here in a vegetarian or vegan athlete because a lot of those sources are not within their dietary preferences. Phosphorus and magnesium are other nutrients of note we would really encourage that individual to focus on. So yogurt, nuts, oatmeal, and sardines for phosphorus, and then peanuts, tofu, broccoli, spinach, seeds, and other sources for magnesium. So there's a lot there that I listed out. There's a lot we can modulate to improve outcomes, which biasly I find very cool, but it does really help support a reduction in duration of injury, which is the goal of many individuals, patients, and athletes. And we can come back stronger and ready to rock activity.
That's so cool. You just named like every food that's out there.
I just might have. There's a lot involved. Riley, as always, we like to break down myths and misconceptions on our topic. Can you walk us through 5 common myths when it comes to sports injury and recovery?
Absolutely. I found some common myths from an article. It was from UT Health Austin. So I pulled all of these myths from this article that I thought just did a great job. So let's talk about them and break them down a little bit. Myth number 1, you should apply heat to a fresh injury. You might have heard that this helps wounds heal faster, so it must be right? Not exactly. Heat does increase circulation, but for acute injuries, that means more swelling and more pain. It could slow down the healing process. Ice or cold therapy actually might be the better option for you. Heat can come later after the first 48 to 72 hours. Myth number 2, complete rest is best. After the initial rest period, gentle, pain-free movement, that's actually key. It's bringing oxygen and nutrients to help healing. Just avoid pushing it too hard or too soon. Follow your physician, follow your body and what it's telling you, or your physical therapist recommendations. Myth number 3, if it moves, it is not broken. Even small fractures might let you move them. Just because you can doesn't mean that it's fine. Persistent pain, swelling, or bruising, experiencing nausea or vomiting, go get it checked out by a professional. Myth number 4, you can run through shin splints. Shin splints are common for running and injury and can be caused by overusing or overtraining. Continuing to run through pain might make it worse. Notice your body's signals and don't push through the pain. Consider low-impact training such as cycling, elliptical, or walking for your exercise in the meantime. And always get evaluated if the pain persists. Myth number 5, surgery is the only solution out there. Obviously super false. Many injuries do not lead or need surgery, but respond well to physical therapy, rehab, nutrition, and other recovery modalities. Those are the myths.
Nice. Well, let's wrap up today by discussing a more topical event that's all about injury and return to play. Lindsey Vonn is a household name. We mentioned her earlier with Nicole. She's an incredible athlete. Really fun to see her amazing career over the years. Let's unpack her experience at the 2026 Cortina Winter Olympics.
So, Lindsey Vonn is one of the most accomplished alpine skiers in history. After retiring in 2019, Vonn made the decision to return to competition at age 41, qualifying for her fifth Olympic Games. Just 1 week before the event, she tore her ACL. Despite the injury, she was cleared to race and chose to push forward. Tragically, on her first run, she caught her arm on a gate flag, which sent her tumbling down the course. She suffered multiple injuries and had to be airlifted off of the mountain. Her story is a powerful example of both the risks elite athletes face and the resilience required to return to sport after injury. Sara, did you watch it?
I did. I watched like a slow down version of it because I'm incredibly nerdy and I wanted to see like when she was in the air if she could correct it rotationally and like how much time she would have to correct it. Definitely brutal. Going 70 miles per hour downhill, there's inherent risk for anyone doing that, even the most trained, controlled athletes. And sometimes you just get unlucky. And that just was totally unlucky to hit that gate and then just not have enough time to course correct things.
Sure. I'm curious. I mean, you spoke a little bit to your reaction to this event, but do you believe that she should have raced?
That's a great question. I believe there was quite a bit of controversy about this. I think I often like to look at things from more of that like bird's eye view. I like to zoom out and really consider all the factors. I've never raced or competed at that level, and I never will in my life. I just know myself. I know my abilities. I think it's really easy for many of us when we're watching from a screen and we're watching from far away to have that knee-jerk reaction and say, "Oh, I would never." However, I think about Olympians and they sacrifice so much and they put so much on the line, and they've been training their whole lives for a type of moment like this. And so from my perspective, the fact that she had a medical team, she consulted with them. She didn't just say, I'm going to just go for it and not take other opinions into account. She consulted with a physiotherapist or what we would call physical therapists in the States, and then did really well in practice runs. ACL seemed fine. It's not her first rodeo with an ACL tear. She's been through multiple. And I think at the end of the day, it was a decision that was made, and from what her quote has stated, she doesn't regret it, and I would say if I was on that hill, I don't think I'd regret it either because, like, the knee did what it could do, and this was kind of an extraneous variable that just got in the way.
Yeah.
What about you?
Yeah. Well,
Yeah.
let me read a little bit more. I pulled up her Instagram post
Oh, yeah, read
and
that
a
quote.
few things stuck out for me. So I'm not going to read the entire thing, but a few things that stuck out. So, quoting from her Instagram post, she said, "Yesterday, my Olympic dream did not finish the way I dreamt it would. It wasn't a storybook ending or a fairy tale. It was just life. I dared to dream and had worked so hard to achieve it." Later in the post, she goes to say, "While yesterday did not end the way I had hoped, and despite the intense pain it caused, I have no regrets. Standing in the starting gate yesterday was an incredible feeling that I will never forget. Knowing I stood there having a chance to win was always a victory in and of itself. I always knew that racing was a risk. It always was and always will be an incredibly dangerous sport. And similar to ski racing, we take risks in life. We dream, we love, we jump. And sometimes we fall. Sometimes our hearts are broken, and sometimes we don't achieve the dreams we know we could have. But that is also the beauty of life. We can try."
Oh, I just got chills with that.
Yeah.
I loved that. I don't think I could say anything more eloquently than that. Sometimes the effort of trying and pushing yourself to places you never thought you could be is just as sweet of a reward than neatly executing a finish. Just to know that you can get back out there and get back up and try it again.
Yeah.
That's incredible.
Yeah. If we're competing at an Olympic athlete level, there is so much wrapped up. It's our life. It's so deeply wrapped up into our sense of identity and just who we are. And so making that decision, I think there was a lot of heat and a lot of controversy of if she should or shouldn't race, but I think that she made the best decision for herself, knowing that there were risks. She named them in her post.
Mm-hmm.
So that's just my initial thought in response to it, was this is a big, challenging decision that she had to make, and knowing that there were risks. And unfortunately, it didn't work out, but sometimes it doesn't.
Yeah, absolutely. Yeah, I think there's a lot there. There's determination, there's dedication, and there's also that acknowledgement and acceptance of the failure and the risk that there could be. What's amazing within all of that is still that drive and desire to go after it in a calculated way,
Sure.
right? I think there's an absolute difference between being reckless or underdeveloped in a sport, right? And pushing way beyond trained ability level. And therefore, you're putting yourself and others at risk. But like you said, this has been her life for forever. This is what she's been training for forever. She knows her body. She's really in tune. She has a great team of healthcare professionals that travel with all athletes to the Olympics and make sure that they're competing safely and taking care of brain and body and all those good bits. And it was, for me personally, really exciting to see her give it a go, even if it wasn't the end result anyone was anticipating.
Yeah. Injury happens. We don't expect it. We don't think about it when we go into it, but taking care of ourselves and making that difficult decision if we need to.
Completely. Yeah. Doing the best you can with the information you have, with the resources you have, knowing when it's okay to push forward a little bit more and also being okay to pull back. It's a collaborative decision and approach, and it really does take that important pause to reflect and see what makes sense for you. So ultimately, I would say my takeaway is it's individualized, it's a collaborative process, and you should certainly meet yourself where you're at and know that there's risk in life, and what makes sense for your unique circumstance might look entirely different for an Olympian, and that's okay. That's totally okay.
Yeah. Well, Sarah, should we wrap up the episode here?
Yeah, I think this is a good time to call it.
Well, thank you all so much for being here and listening to the Be Well Collective. We truly appreciate each and every one of you. If you enjoyed this episode, feel free to rate or subscribe to our channel. We would also love to hear your feedback, questions, or ideas for future topics. Do you have something in mind? Email us at bewellpodcast@aruplab.com. Take care of yourselves, take care of others, and as always, be well. Thanks for listening to the Be Well Collective. If you have any ideas for future episodes or questions, please email bewellpodcast@aruplab.com. If you liked what you heard here, rate and subscribe for more. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. ARUP Laboratory and the Be Well Collective do not assume responsibility or liability for the actions, decisions, choices, or opinions of the individual listener. The content shared should not be used as a substitute for diagnosis, treatment, or medical guidance. Always consult with a qualified healthcare provider before making any changes to your care plan. Listening to this podcast does not create a provider-patient relationship. Use your discretion and take responsibility for your own health decisions. The show is produced by Riley Speth and Sara Hillring. Today's episode was audio engineered by Arthur Vienema.